Hi y'all, this is Dr. Imtiaz. You can find me at Hormone Doc on Instagram. Today we are doing a male pellets. I'm injecting this gentleman with testosterone pellets to help him feel better. It's a sterile procedure, so I've already prepped him quite well. And now I'm putting on a sterile drape here. Next, I'm gonna numb him. We'll just do some more cleaning just for good measures. All right. I usually just apply a little bit of betadine, let it dry out while I'm getting my things together. Never hurts to have a little bit extra. All right, so I'm just gonna inject some lidocaine in this area. So everybody's hormone levels are different. It's an individualized treatment. And it really is based on the symptoms and age and other medical problems and whatever else you may be feeling. And once I have a better picture of what your symptoms are, I can try to figure out how best to address them. So for this gentleman, he was just feeling tired. He was having trouble getting his muscles to get stronger when he works out. He just wants to improve the quality of life. And I hope that he feels better pretty soon. So this is his first time getting hormones. I'm just going to give you some lidocaine, okay? Little stick, it feels like a bee sting. There we go. And then it goes numb. So male pellets are very different from female pellets. A lot of guys get pellets and they're sore afterwards, and their wives get pellets and they're like, oh, you're a wuss, I don't feel any pain, it doesn't hurt. You guys, it gets sore. Men do get sore, and the reason is that guys get a lot more pellets, and your pellets are obviously bigger because men have more testosterone than women do. So if you are sore afterwards, it's legit. Don't let your wife tell you it's in your head. And I'm just numbing and numbing some more. And I want to make sure he's comfortable. Doing okay?
Yes.
Perfect. Now you cannot work out using your legs for about 5 days. And no bath for 5 days. I'd like you to keep it covered for as long as possible. Because you have a lot of pellets that are about to go in, if you overexert yourself, they can sometimes come out or they can start bleeding. So I'm just confirming that this is the right dosage. And it is. And now I'm going to make a small incision. First I'm going to check. Can you rotate your hips forward? Thank you so much. Yep. You okay?
Yes.
Perfect. And if someone has a weak stomach, by all means, look away. It's a procedure. And you didn't feel that, right?
Right.
And he is good and numb by now. And this is a trocar. And I'm inserting the trocar so that I can inject the pellets. Did you feel that?
Not really.
Nope. And that's pretty cool, right? Because who wants to hurt for this? Okay. So one of the things I like to do with male pellets is I use a specific technique to prevent them from stacking one on top of each other. And I try to fan them out so that they're not sitting on top of each other. That helps to reduce the risk of complications afterwards, reduces the risk of them coming out. And sometimes you may feel these pellets, okay, under your skin. That's normal. And as your heart beats, blood flows by, it picks up a little bit of the testosterone, and that's how the hormones get into your bloodstream. And with time, these will all dissolve and they'll be gone. Now once I put these in, I cannot take them out. It's a one-way street. So I usually start a little on the low side, and I'll check some levels in a few weeks to see how you metabolize these hormones, because I can always inject some more, but I can't take them out. You excited?
Yes.
I'm excited for you.
A good change, I hope.
I hope so. I think it will be. As you guys can see, he's very comfortable. He's not hurting. He is going to be sore later today. You are going to be sore. And it's okay to take some Tylenol if you need it. You may be sore for several days. And I want you to be careful with your wallet. Guys often will put a wallet in their back pocket and they sit right on this insertion site. And that's not going to work. So I'd like you to avoid, in general, you shouldn't be putting your wallet in your back pocket because it actually causes sciatica. But please avoid that when you have the pellets, because it can actually really cause them to come out. And that's one of the more common complications with male pellets, is sometimes they do get extruded. And we are done with the insertion. You did so good.
Okay.
So now I'm going to apply some sterile dressing here. This is an airtight dressing. So if you could please leave that on as long as possible. If you can avoid taking a shower for at least 24 hours. And I'm just putting the edges of the skin together with this. Are you going to watch your video later?
Probably so.
That would be kind of cool. Bet you not too many people have seen their pellet insertion.
Yeah, tell my wife I'm a movie star.
Exactly. And if this watertight dressing comes off, hon, I would first of all like you to just keep it on as long as possible. But if for some reason it comes off, you can always get another one from the drugstore, and please reapply it. Let this area heal. Once it heals, it's gonna be golden. But in the beginning, if you overdo the activity, it's not gonna heal right.
Okay.
If you have a fever, I want to hear about it. If you have bleeding, put some pressure on, call me. Okay? That's all, folks.